Hello and welcome to our discussion, Introduction to Hospice. This is brought to you by United Hospice and EdTech on Healthcare Consulting, your partner in hospice operations and compliance. We will be guiding you throughout your agency's operations to ensure your healthcare company's success. Hospice care is a special kind of care that focuses on the quality of life for people who are experiencing an advanced, life-limiting illness and their caregivers. This provides compassionate care for people in the last phases of incurable disease, so that they may live as fully and comfortably as possible. Hospice care focuses on quality of life when a cure is no longer possible, or the burdens of treatment outweigh the benefits. This care is not just for cancer or older people. It is for any serious illness at any age. Hospice care is an interdisciplinary team-oriented approach to expert medical care, pain management, and emotional and spiritual support, expressly tailored to the patient's and family or inner circle's wishes and needs. Hospice care is provided by a team that works together focusing on the patient's needs, whether physical, emotional, and spiritual. The goal of hospice is to keep the patient as pain-free as possible, with loved ones nearby. What is hospice philosophy? Imagine a quilt that's been lovingly crafted to provide warmth and comfort to someone in need. Each square represents a different aspect of care, stitched together to create a holistic and supportive environment. That's what hospice philosophy is all about, ensuring that every piece of the puzzle is in place to give patients and their families the best possible care during a difficult time. The hospice philosophy of care is built on 5 core principles. Let's take a closer look at each of them. First is patient-centered care. In hospice care, the focus is always on the patient. Their needs, desires, and goals take center stage, and care plans are tailored to meet their unique situation. It's like designing a custom-made garden, where every plant and landscape element is thoughtfully chosen to create a serene and beautiful sanctuary. Second is pain and symptom management. One of the primary goals of hospice care is to ensure patients experience as little discomfort as possible. This means managing pain and other symptoms through medication, therapies, and alternative treatments. Think of it as a gentle, warm embrace, easing physical pain and discomfort burdens. Third is emotional and spiritual support. Hospice care recognizes that the end of life is a deeply emotional and spiritual time for patients and their families. By providing counseling, spiritual guidance, fun activities, and other support services, hospice care helps patients and loved ones navigate this challenging journey. Fourth is the interdisciplinary team approach. Hospice care relies on a team of professionals from various hospice disciplines working together to address the diverse needs of the terminally ill and their families. This includes nurses, social workers, hospice chaplains, and volunteers working harmoniously. And lastly is bereavement support. The grieving process doesn't end with the death of a loved one. Hospice care supports family members through bereavement counseling and other resources, helping them cope with their loss, find healing, and guide those left behind through the stormy waters of grief. Adopting the hospice philosophy of care can profoundly impact the lives of patients and their families. Some benefits include improved quality of life for the patient and family members or caregiver taking care of the patient, reduced hospitalizations and emergency room visits by managing symptoms at the patient's current setting, and not adding further discomfort for both the patient and their loved ones. Increased feelings of support and understanding reduces anxiety on the patient as well as the family that are dealing with effects of terminal illness. Enhanced sense of dignity and control creates an atmosphere wherein the patient and family have the support to determine how they would deal with their unique situation, and knowing that there is a team of hospice professionals from various disciplines working together for the benefit of the patient and their loved ones. And ultimately, greater peace of mind for the hospice patients and loved ones. Interdisciplinary teams represent the core of hospice and palliative care services. The team is comprised of physicians, nurses, social workers, and bereavement spiritual counselors, among other disciplines, and are responsible for coordinating a holistic plan of care for patients. The interdisciplinary nature of hospice teams presents an opportunity to understand not only what they perceive as the most important components of hospice care, but also to gain insight into the types of knowledge, attitudes, and resources that shape hospice care delivery for patients with life-limiting terminal illnesses. The interdisciplinary team formulates the individualized plan of care for every unique hospice patient and manages the delivery of services from different hospice disciplines in providing comfort and better quality of life for the patients and their respective family. For CMS conditions of participation, the interdisciplinary team must meet to discuss the status and needs of each hospice patient every 15 days. However, more frequent meetings may be necessary depending on the patient's needs. The delivery of hospice services is facilitated by your hospice team. The Center for Medicare and Medicaid Services regulates the delivery of these services and must conform with CMS conditions of participation. All hospice agencies must meet the stringent requirements of both CMS and the state from which the hospice operates. Meet your professionals that comprises your hospice team. The medical director works directly with the patient's attending physician to coordinate the plan of care for the patient, provides effective pain and symptom management, and collaborates with the interdisciplinary team on the patient's individualized plan of care to make sure their physical, psychological, emotional, and spiritual needs are being met. The skilled nurses regularly assess patients' needs, manage symptoms, and report changes to the attending physician and/or medical director. Skilled nurses will also teach, supervise, and counsel the hospice patient and family members on providing care. Social workers provide counseling, emotional, bereavement support, and will assist patients and families with addressing financial concerns and community resources. Spiritual counselors provide spiritual, bereavement, and emotional support to patients and family members, assist with funeral or memorial arrangements, and work with community clergy. Hospice aides provide personal care and light housekeeping, as well as emotional support and compassionate care to their respective patient and family members. Volunteers provide support and companionship to patients. Trained volunteers can provide services such as running errands, grocery shopping, or providing respite services to caregivers and family members. Additional hospice services provided. Bereavement services are available to family members and caregivers. These services can include grief counseling and community support groups. Therapy services. Physical, occupational, and speech-language pathology services are available to help the patient in maintaining activities of daily living, as well as provide training on how to use assistive devices, instructing caregivers and families on good body mechanics for turning and lifting patients and/or home safety. There are a number of misconceptions about hospice that deter the patients and their family from getting the full benefit of the hospice program. First, myth versus truth. Hospice is giving up and losing hope. Truth. Unlike other medical care, hospice focuses exclusively on a person's comfort and dignity near life's end. Initially, when serious illness strikes, stopping or altering its course is usually the primary hope of patients. But sometimes the reality is that no cure exists, or aggressive treatment for advanced illness is unsuccessful despite expert medical intervention. As treatment fails, often leaving a person debilitated by curative efforts, symptoms continue to progress. A person's concept of hope then shifts to other priorities. At the end of life, most people hope for quality of life, comfort, and peace. They want to be near loved ones and around familiar possessions. Hospice makes these goals possible by ensuring that a person's quality of life is the top priority. Hospice provides expert pain and other symptom management overseen by a physician and nurse, as well as support from a team of professionals, including social workers, chaplains, and certified nursing assistants. Next, myth versus truth. Hospice is only for cancer patients. Truth. When hospice began in the U.S. in the mid-1970s, most people cared for by hospice had cancer. Today, while many hospice patients have cancer, the majority have other life-limiting illnesses, such as end-stage heart disease, neurodegenerative diseases, such as Parkinson's disease, lung or kidney disease, or Alzheimer's and other dementias. Next, myth versus truth. Hospice is where people go to die. Truth. Most hospice patients receive care in their place of residence, which includes private homes, assisted living communities, and long-term care facilities. In some instances, hospice is provided in an inpatient hospice setting for people whose pain or other symptoms cannot be adequately managed in their homes. Fourth myth versus truth. Hospice is for people whose death is hours or a few days away. Truth. Most families tell Hospice Foundation of America that they wish their loved one had received hospice care much earlier in their illness. Hospice care can be accessed up to 6 months before an expected death, giving patients time with family, friends, and pets, and the possibility of extended support from the hospice interdisciplinary team. Although hospice care neither hastens death nor prolongs life, studies show that patients with certain illnesses live somewhat longer with hospice care than those with the same illness who don't choose hospice care. Next myth versus truth. You can't keep your own doctor if you enter a hospice program. Truth. With hospice, a person's family doctor or specialist is encouraged to remain engaged in their care. The hospice physician is able to communicate with the physician, who may know the person better medically than anyone else, to determine the specific medical needs that will be addressed in developing an individual plan of care. Another myth versus truth. It is the doctor's responsibility to bring up hospice. Truth. While it is the physician's responsibility to determine whether a patient meets the medical eligibility criteria to receive hospice services, the patient or caregiver can initiate the discussion. Since hospices consistently hear from their patients' families that they wish they had received hospice care sooner, it is a good idea to let the physician know at the time of diagnosis with any life-threatening illness that you are open to discussing hospice care at the appropriate time. Patients and families can also contact a hospice directly to learn more about their services. It is not necessary to have a physician's referral for the initial call. Another myth versus truth. Once the choice is made for hospice care, there is no turning back. Truth. Individuals are free to leave a hospice program at any time for any reason without penalty. Re-enrollment in a hospice program is permitted as long as medical eligibility criteria is met. Next myth versus truth. Other medical care is not available to hospice patients. Truth. While the hospice team will provide all aspects of care for the illness that qualifies a person for hospice services, hospice patients are still free to seek treatment for unrelated illnesses or conditions. For example, if someone is receiving hospice care for heart disease, falls, and breaks their arm, treatment for the broken arm would be available. Here is another myth versus truth. Hospice requires a DNR, do not resuscitate order. Truth. The purpose and benefit of hospice care is to allow for a peaceful death in a comfortable and familiar setting like home with loved ones near. While many people who choose hospice care wish to have a DNR to avoid unnecessary medical intervention and hospitalization, a DNR is not required to receive hospice care. Myth versus truth. Hospice professionals hasten death. Truth. The focus of hospice care is solely to relieve symptoms, such as pain, anxiety, and breathlessness, at the end of life, allowing natural death to occur in peace and with dignity. The medications used at end of life are for symptom relief only and are never used to hasten death. Next myth versus truth. Hospice is only for the elderly. Truth. Hospice care is available to anyone of any age who meets eligibility. Government regulations surrounding care for those under 18 are different than guidelines for adults and allow concurrent care that includes efforts focused on both cure and comfort. Myth versus truth. All hospices are the same. Truth. There are thousands of hospices in the United States. If they participate with Medicare, as most do, they are required to provide certain services to the patient and documentation to the government. In that respect, they are the same. However, hospices may be non-profit or for-profit. They may be community-based or serve many communities, cities, or states from a central location. They may be independent or part of another organization, such as a hospital, health system, or private company. Some communities may have multiple hospice programs serving them, all of which are independent from the other. All hospices that participate with Medicare meet the same basic requirements, although there likely are differences from one provider to the next. I will end this hospice discussion for now, and we are looking forward to providing you with more information about the hospice program as we go along. I hope you learned something from our presentation today. This presentation is brought to you by United Hospice and EdTech on Healthcare Consulting. For more information about the excellent care that United Hospice provides, please call their intake at 847-779-3989.